Facebook.
Oh, welcome everyone to Michigan Communities Conquering COVID Town Hall. I would like to open it up for Angelica Snyder, who will provide Spanish interpretation.
Thank you very much. Buenas tardes a todos. Bienvenidos a Comunidades de Michigan Conquistando COVID. Me llamo Angélica Snyder. Seré la intérprete para la sesión de hoy. Si prefiere escuchar todo esto en español, por favor, hagan clic en el icono en forma de círculo a la parte de abajo de su pantalla que dice interpretación y escojan el idioma español. Si está usando una tableta, puede escogerlo en los 3 puntos de la esquina superior derecha. Escoge interpretación y después español. Gracias y bienvenidos.
Thank you, Ms. Snyder. At this time, we will begin with the introductions of the panelists. First, I'm your moderator, Dana Banks. I'm a regulatory analyst at the Institutional Review Board of Human Subjects in the Office of Research at the University of Michigan Medical School. I am also the mother of 4 daughters, ages 22 to 12 years old. And I am an African-American woman who is in my late 40s with a very short reddish afro. I'm wearing a black blazer and a white shirt, and I use the pronouns she and her. And I will allow each panelist to introduce themselves and their affiliations. Dr. Lloyd, we will start with you.
Hi, everyone. My name is Elizabeth Lloyd. I go by Liz. I'm a pediatric infectious disease specialist at CS Mott Children's Hospital at Michigan Medicine. I've done a lot of work with the COVID vaccine and monoclonal antibodies for COVID for children. I do have an 18-month-old who's in daycare, so have been through a lot of the same stuff that many parents out there have been through during this pandemic. As far as what I look like, I am a white woman in my mid-30s. I'm wearing glasses and I have shoulder-length reddish blonde hair. I also use the pronouns she, her.
Thank you, Dr. Lloyd. Dr. Edwards-Johnson, you're next.
Thank you. I'm Jennifer Edwards-Johnson. I am a family physician and community assistant dean of Michigan State's College of Human Medicine Flint campus. I also have 2 children who are 3 and 6, and we're navigating this pandemic together. And, you know, I have personal and professional reasons for being really excited about the opportunity to talk about COVID vaccinations in kids. I use the pronouns she and her. I am a Black female in my mid-30s, and I have my hair in a bun and a black shirt on.
Thank you, Dr. Edwards-Johnson. Ms. Rinaldi, you are next.
Hi, everyone. I'm Lauren Rinaldi. I use the pronouns she, her. I am the Director of Communications for ETR, which is a national health equity organization. I'm also the former director of the Adolescent Health Initiative at Michigan Medicine and the former vice president of the Society of Adolescent Health and Medicine Michigan chapter. And I have a 2nd and 4th grader as well. So we are also in the thick of navigating COVID vaccines. And I am a white woman in my early 40s. I have shoulder length brown hair and I'm wearing a teal sweater tonight.
Thank you, Ms. Rinaldi. And Dr. Sinti, you're next.
Hello, sorry, Sandro Sinti, he, him. I'm an infectious disease physician at the University of Michigan. I've been there for about 25 years. I have 2 sons, 28 and 30. I am a Caucasian white male. What hair I have is brown and gray. Wearing a blue shirt and glasses, collared shirt.
Thank you, Dr. Sinti. So again, I would like to thank all of our panelists for being here tonight. And before we get started, Tricia, can you please tell us how this series of town hall meetings began?
Thank you, Dana. My name is Tricia Pachowski. I work at the Michigan Institute for Clinical and Health Research at the medical school. I'm a white woman in my mid-40s with short, dark hair. I'm wearing a black top with white hearts, and I use the pronoun she, her, hers. This is the 9th installment of our COVID town hall. It is a partnership between MICHR and our Michigan Conquering COVID's project, or MySeal. And we've been funded for over a year to focus on health disparities and COVID-19 in 4 counties: Wayne, Washtenaw, Kent, and Genesee. Our faculty leads are Barbara Israel, who's with us tonight from the School of Public Health, and Dr. Erica Marsh from OBGYN. So really quick on housekeeping, we will take a break midway to give Angelica, our interpreter, a chance to just stretch and drink some water. And if you have any questions that you want to ask panelists tonight, please do so in the bottom of your screen in the Q&A. If you're joining live by Facebook, we just ask you to put your question in the comments, and Amy Rooker, our communication specialist, will let me know to ask the panelists. Welcome to everyone.
Thank you, Tricia. So again, we're here tonight to discuss the parental vaccine hesitancy for their children ages 5 to 11 years old. And we also would like to discuss strategies for safely celebrating with your family this holiday season. So I would like to ask each one of you a question, but if there's anything that you'd like to say or follow up with any of the speakers, please feel free to just unmute yourself and say and jump in at any time. Dr. Lloyd, the first question is for you. There are many reasons people have expressed hesitancy about the COVID vaccine. Some parents believe that it isn't safe because it was developed so quickly, and there was not adequate time to test during clinical trials. Can you tell us first if there was a clinical trial, and if so, what were the findings?
Yes. And so I'll start by kind of briefly talking about how this vaccine and all vaccines are developed, because I think that helps put it into context. And so every vaccine goes through sort of a predetermined set of steps. The first is there's a lot of research that goes into the infectious agent. So in this case, it's a virus, but could be bacteria, whatever it is, to make sure we understand it so that we can even start to design a vaccine that's going to be effective for it. In our case, with the COVID vaccines, we actually were lucky because we know a lot about coronaviruses just because they circulate year-round or seasonally every year. So there's multiple coronaviruses that cause usually common cold symptoms every winter. We know a lot about them. And then there have been past sort of breakouts of other coronaviruses, like the original SARS, severe acute respiratory syndrome, and MERS, Middle Eastern respiratory syndrome. And these both caused a lot of panic at the time that they started circulating, because they have even worse mortality rates than COVID does. So people learned a lot about them and started developing vaccines targeted towards them in the first place. So we had a really strong foundation for research, which helped us, I think, expedite through this sort of preclinical research phase, because we had this background knowledge compared to if this was a brand new virus that we knew nothing about. So that's one reason that we were able to develop these vaccines a little bit quicker. But then, yes, we went through all phases of the clinical trials. So there's 3 main phases of clinical trials that look at safety and efficacy are the 2 big things that they look at. So generally they give one group of children, in this case children, the vaccine, and then another group gets placebo, which is generally an injection of saline or salt water. And they look at the differences in the side effects that happen and the differences in whether it works to actually prevent COVID infection. And so in this case, they ultimately included over 3,000 children in their vaccine trials. And what they found was that the vaccine was nearly 91% effective in this age group at preventing children from getting COVID. And what the side effects that they found are similar to what you would find, in older children and in adults who have been getting COVID vaccine all along. So the most common was some pain at the injection site. You can get redness and swelling at the injection site. The second most common were kind of fatigue and headaches. Much less commonly, people did get fevers occasionally, body aches, sometimes some lymph node swelling, often in the armpit. But it actually seems like possibly kids are even less likely to get side effects than older teenagers and adults are. They didn't find any severe side effects in the clinical trials themselves. But then even after the clinical trials, there's still ongoing safety monitoring. So these vaccines have been so closely monitored, probably more so than any other vaccines out there at this point. So we have a lot of information about them and their safety. So hopefully that's reassuring to parents to know there were good reasons that we were able to speed through this process. One, because we knew so much about the virus already. Two, because we are in a global pandemic. There has never been more information sharing and resources targeted towards this. So I think even though, yes, they were developed faster than I ever thought they could be, but for good reason. And the data does show that they're safe and they're effective.
Thank you, Dr. Lloyd. The next question I have, and before I go into the next question, Dr. Edwards-Johnson, I saw you shaking your head, and you were really like connecting to what Dr. Lloyd was saying. So did you have anything that you'd like to add?
No, I thought that was a fantastic summary. And I think the piece that resonated the most was the idea that there are ongoing studies, and we've since vaccinated a large portion of the population of children, and we've not seen severe side effects. And I think that's a really important piece. I think when we consider whether to vaccinate our kids, we're weighing the risk of disease with the risk of vaccination. And the risk of vaccination is so significantly low that it really makes us feel really good about making these decisions.
Thank you. And that kind of leads me into the next question, which if you'd like to answer that, that'd be great. Like, what is the best argument for getting children vaccinated that will convince those who say it's not as necessary to vaccinate kids because they don't get as sick?
I have to agree, right? We have been lucky that kids have not gotten sick or as severely ill at the rate that our adults have. And that is, we are fortunate in that way, but kids still do get sick, right? We know that kids still get sick, and we've seen the rise in COVID cases among children. There are 3 really good reasons to still consider getting your kids vaccinated, even though it feels like the risk feels fairly low when we think about severe illness. One, it's that point I just made, right? The risk of vaccination is so low relative to the risks associated with actual COVID-19. So we know with COVID-19, there is that risk of myocarditis that we hear people talking about. There's that risk of clot. There's that risk of MIS-C or multi-system inflammatory syndrome, right? So there are all these severe risks that we really worry about. And we have all of this great data about the vaccine and very, very low risks that are associated with the vaccine. The second reason is that we don't have a lot of treatments for kids, as many treatments as we have for adults or that have been approved for adults, right? So those antibody treatments that you hear about that adults are able to get, they're not approved yet for our kids under age 12. So we don't have as many options as we do when our kids do get sick. The third reason is that kids can still spread COVID, right? Kids can still be a vector for COVID in your family members who you're hopefully able to visit during the holiday or you're able to see safely during the holiday. You know, your sick or older family members who are at risk for severe disease, kids can still spread that to them. So those are the 3 reasons I think about when I really talk to my patients in the office about why it's important to get their kids vaccinated.
I agree, and I can. Oh, sorry. I was going to say I can add a few more reasons too. I do think those are fabulous.
We can go round robin for that.
So, kids get sick. We see it. I see it every time I'm in the hospital. There's sick children who are admitted with COVID in the ICU. But even those that don't get that sick are at risk for this multisystem inflammatory syndrome in children, the MISC. But also some kids really do get these prolonged symptoms that last a long time and can really impact their daily life. We've actually had to set up a pediatric post-COVID clinic at University of Michigan because we were seeing so many kids who just had these persistent symptoms. And most of them really did have mild disease, but it's just, people who have had COVID out there may know, I hear stories, people didn't, my sister-in-law didn't get her sense of smell or taste or any of that stuff back for weeks and weeks, but it's, it's worse. It's, they don't feel like they're breathing right. They're just so tired. They're getting fevers. So I think that's another really good reason. The other reason I want to say is that, I mentioned I'm a mom of a child in daycare who clearly cannot be vaccinated yet. And it is, as I'm sure everybody listening knows, it can be so disruptive when you have to quarantine yet again and this and that. But it's really important for our kids to be able to go to daycare, to go to school, to have these normal childhood developmental, milestones and to participate in activities. And they're naturally going to potentially have exposures in those settings. So I think, being vaccinated not only protects them, but it also can affect the way that they have to quarantine or not and going forward, which is disruptive not only to the child, but to the parents, to the whole family. So those are reasons to think about really getting your child vaccinated.
I was going to add on to, yeah, thank you. I was going to add on to that as well as a parent and like a working professional. A lot of times, parents may not be that concerned about their kids getting sick, but with everything we've experienced in this pandemic, a lot of parents are concerned about their kids missing more school. And our kids have been out of school a lot in the past 18 months. And so a lot of conversations I've had with parents are around, well, even if your child doesn't get that sick, what is the impact on you and your family and your child if you have to be out of school for 10 days, or you have to have a child at home while you're trying to work for 10 days, or you have to take off additional time from work to be able to be home with a quarantine child. And I think that talking with people about, what's your plan if you aren't planning to vaccinate your children and they are then at greater risk for getting COVID, even if they don't get sick, how does this impact you if you suddenly have to have your life disrupted yet again for another 7 to 10 days?
Thank you. Dr. Sinti, did you have something that you'd like to add?
Well, I think globally, one other issue is everybody sees these variants come along, and the more people vaccinated, the less likely these variants will develop. Because coronavirus, it doesn't change as much as even flu virus if you just take the regular coronavirus. And the reason this one's changing is because it spreads like wildfire all over the world. And so if you have people vaccinated, it prevents those opportunities to switch. And so we're waiting for this new variant, and there probably will be others because most places around the world aren't able to get 70-80% of their population vaccinated. So we should do what we can in this country to prevent that.
That's really good information. And I have some questions now that plays off of that information, which is social media. So I think I read the statistic that 96% of parents use social media, and then there's 68% of them use social media for their health information. And I'm sure you all know that when you come in contact with patients and they have their print off of Dr. Google, and they have all this information that telling you what they should do. But along that line of thought, how do we deal with people who get their information from social media and they feel like they are getting that information from a trusted source? They feel like they got this information from a person who may have a degree or they're educated, they trust this person, and this person just basically said, the sky is falling about their vaccination, or my kid got vaccinated 2 days ago and I found them on the floor having a seizure. And I didn't make that up. I actually read that through a couple days ago. So how do we navigate through that? How do we deal with that? Go ahead.
Absolutely. So, I think this is every webinar I do, I plug primary care, right? Because having great relationships with your primary care provider, having that trusted source, having that person that you've navigated medical conditions with before is priceless. And, when you come into your primary care office, it's an opportunity to say, I read this on Google, or I saw this on social media. Is this true? And one of the reasons that, we're able to make some movement, we're able to talk to people about vaccines in the office is because we've talked to them about preventative care before. We've talked to them about their health before. And so it's not a new conversation when we start that conversation in the office and we say, have you considered getting your COVID vaccine? And you talk to me about the reasons why you're concerned. That's exactly how the patient primary care relationship should work. So I really encourage people who are seeing information on Google that they're not sure about. It's absolutely reasonable, and we should be arming ourselves with information, but then you check and verify with your trusted source of information, which hopefully is your primary care doctor.
Yeah, I totally echo that. Every time I do one of these town halls or webinars, I really encourage anyone who has any ongoing hesitancy, concerns, questions to talk to their primary care provider. And I think, earlier, one of the questions was, what's the best argument, right? And I think that's the trick, right? Because the best argument for one person is not necessarily going to be the best argument for another person, because not everyone has the same beliefs or concerns about the vaccine. So really the best way to address that is to have this one-on-one conversation, which obviously we can't necessarily do tonight with all of our audience members. I think we're trying to get as close as possible. But that's really where this primary care physician comes in. And so I completely encourage people to, take advantage of that. They're a resource, a trusted resource. And I think we know that many families really do value what their primary care provider has to say about vaccines, especially. So I think those conversations are essential.
I think as well, people are so used to going online for information, whether it's a website or Google or social media. And so it's also a really good reminder for all of us and the organizations that we work with and represent that we should be putting that information out as well, so that we can counter some of that and say to our patients, our clients, our friends and family, whoever, here's what we've put out. Here's the information that we have available to us. Here's what we know to be true. Here's the science-based information. Because I do think that people are often they're looking for something outside of that singular relationship, which I agree with both of you is so incredibly important. But having other, documentation that comes from the trusted organizations that they're familiar with, to counter all of the things that are out there and misinformation that's out there, is also just important for us to do as well.
Thank you. So we can't avoid thinking about the cultural aspects of vaccines. And honestly, as a Black woman, when the vaccine first came out, I said, well, I'll just wait and see. Because, I know about social determinants of health and I understand underlying health conditions, but I've never really been first in line to get anything in America. So I don't think I'm going to be first in line for this. And that's just how I felt. And that was kind of like my tagline, things I would say, even though I understand how vaccines work. But honestly, after so many people in my circle were passing away, and then the last step was I could not really bring myself to have to ask my kids to buy burial clothes for me or to go through the whole burial process for me, when there was an opportunity that I had a life raft that I just chose not to hold on to, just chose not to take advantage of. So we can't dismiss the cultural aspects of vaccine hesitancy. So how do you discuss that for Black and Brown communities when every other part of their life, their daily life, they are not experiencing premier care, even with their primary health, their primary care physician? And anyone can answer that question.
I can start off. It is very difficult. I have quite a diverse group of HIV patients. I'm an infectious disease physician, and it's even hard to convince some people in those groups to get vaccinated. And I think there are two groups. I think there are people who are very scared, terrified of the vaccine, and then there's the people who are the voices in the echo chamber that are. It's a lower group that is scaring those people by giving them information that's not true. And so I think we really have to attend to the fear, and our tendency can be to discount people who don't want to get the vaccine. But when you really look at it, most people are scared. And so I think the point that Dr. Edwards-Johnson and Dr. Lloyd made, and you too, Dana, is that you got to get them to somebody they trust. And so ask them, who do you trust? Sometimes that's difficult. I had one of our workers that I had to try and convince to get the vaccine because she was getting mandated to get it, and she was terrified. She was young, and she thought it might cause sterility. She thought it might hurt her in some other way. She thought it might hurt her children. And I asked her, who do you trust? And she says, I'm not talking to anybody. I go to work, I go home. And her boyfriend or husband was really pulling this other information off the internet and talking about it and making her more scared. So it's not easy. It's not easy, but I think we have to somehow find who is that person. And I've been part of these sessions, and the religious leaders in the community are great for that role, and they're willing to take on that role with with scientific-minded people behind them too. So I think we have to keep doing that. This is a way to do it.
I agree. I think in addition to making sure sort of the information comes from trusted sources, that we have to own the history there, right? We have to own where this mistrust comes from. We have to own the history of racism and medical violence that's been predicated against communities that are predominantly Black and Brown. I think you have to start there. I think you have to start by owning it and recognizing that their fears and concerns are real and valid. And then you are the trusted messenger that starts to unpack some of that and starts to one by one unpack each fear and sort of talk through each sort of piece of misinformation. But I think as a medical profession, we got us here. So we have to be willing to own the work of working with our populations who have been marginalized to take the steps to make decisions that we ultimately think will be helpful.
Thank you. So we have a question in the chat, and it says, what do we know about the vaccine's impact on puberty and future reproductive health?
I can start addressing that. So there are misfounded rumors out there that have gotten a lot of attention, that the vaccine will have some impact on fertility. The reason that this came about was because the spike protein, which is a protein on the outside of the coronavirus that helps it attach to and invade human cells, looked similar to a protein that's in the placenta, which is, the organ that develops to feed, nourish a growing fetus. And so there was some concern by someone that the antibodies that are made against the spike protein would also affect the placenta. But that was not based on any scientific data or evidence at all. There has never been any data or evidence to suggest that that is the case. What we do know is that, originally pregnant women were not included in the original vaccine trials too, which I think left a door open for some concern potentially. But now there's been so many pregnant women who have been vaccinated. There have been women who have been vaccinated prior to pregnancy and gone on to have healthy pregnancies. They've done studies that showed there's no increased risk of miscarriage after getting a COVID vaccine. And we actually know that it protects the fetus, moms pass antibodies onto their babies in the 3rd trimester, that these babies are then born with some degree of protection for multiple months. And then also potentially through breast milk if a woman chooses to breastfeed. So that's what we know. There's also, I think, the flip side with male infertility, there's been studies that show there's no evidence of decreased sperm counts or any untoward effects of, sperm or semen based on the receipt of the vaccine, but at least temporarily, there have been studies that showed sperm counts can be affected by actually getting COVID infection. So that's kind of what we know, but obviously any panelists can add in. I would be curious if there's anything else.
I just think that last point you made is so important. Almost every data set has demonstrated worse symptoms with potentially getting COVID than anything that's been showed with the COVID vaccine. So I appreciate that point about sperm count being decreased should you get COVID. And the vaccines have almost uniformly been shown to decrease all of these risks, like Dr. Lloyd mentioned. So I think that's a really important point.
Yeah, and I guess I didn't mention that pregnant women are at an increased risk of severe disease from COVID to begin with. So they are really a population that really should get vaccinated to protect themselves and to protect their growing baby.
And the national societies, so obstetric societies, maternal fetal health societies have all come out to be supportive of vaccination very early. Even before some of these studies, they were feeling that a pregnant woman is at high risk getting COVID. And so we need to protect that population, and it's safe.
Thank you. We have another question from Facebook. Are there any vaccine side effects that are specific to children? And I think some of you touched on some of that earlier in the conversation, but please address that again, please.
I was the one who talked a little bit about the side effects, and really for the most part, what we have seen based on the clinical trials and then the ongoing data that we've collected since then is that children are generally at risk for the same side effects that adults, older teenagers and adults are getting. One concern has been myocarditis, which again was mentioned earlier. That's inflammation of the heart. That has been seen more often in younger populations, in the kind of teenage and young adult populations, and males in particular. What we have seen so far, so none of the kids in the trial for the 5 to 11 year age group had myocarditis. And there's multiple reasons that cardiologists have said they think that it may actually be less likely to happen in these younger age groups. And that's because they are less likely to get myocarditis in general than some of the older kids. They just in general had less kind of reactive side effects like fevers than some of the older groups did as well in the vaccine trials. But there has not been, I guess to the specific question, there has not been any other side effects that have come up that are specific to kids. Really what kids are getting for side effects are essentially the same as adults, maybe a little bit less severe actually.
Okay, thank you. We'd like to take a break now so that Angelica can reset, and we'll take a 2-minute break. I think the technical assistance people are telling me 2 minutes, and you can turn your cameras off if you like. Welcome back, everyone. That was a much needed break. I needed to crack my neck and so I have one question here. What's the difference between the dose that the FDA has authorized for each age group? So what's the difference in the dose for the 5 to 11-year-olds versus what everyone else is getting?
Yeah, so for 12 and up, the dose is 30 micrograms. The actual number is not that important, but to know that the dose for the 5 to 11-year-olds is 10 micrograms, so it's a third of the dose that the older children and adults are getting.
And I have a question, and it's regarding the terminology of breakthrough cases. I've heard some parents talk about, well, if they're breakthrough cases, that means it doesn't work. So why get it in the first place? And so I'm thinking, I've read that the vaccine naturally wanes over time. So is it really a breakthrough case, or is it just a natural reduction of the efficacy and then you need to get a booster? Because breakthrough sounds like, you know, the virus is so potent that it broke through the ineffective vaccine like a superhero or something. So can you guys discuss that for me?
Yeah, I think it's a bad term. And the reason to say that is because if you think about influenza every year, many people get influenza after getting vaccinated. The difference is they're not in the hospital and dying. They're at home drinking fluids and getting over it. Same thing with COVID. So every time, it seemed in the beginning that every single person who developed COVID after getting vaccinated was labeled as a breakthrough. So it looks like it doesn't work. It's a bad name. It's a bad word to use, I would say. What's happening is what we would naturally expect, which is some people are going to get infected and either won't have any symptoms or have mild symptoms, but it protects them anyways.
Yes, that's good information. So Ms. Renali, we're going to move on as a communication expert. And that's what we've been talking about this. And how do you suggest we communicate with our family and friends about COVID-19 vaccine without offending each other and starting arguments?
It's a hefty question. And I have to say, like, this has not gone perfectly in my life. And it's interesting too, because I think there's two things that we could talk about, and hopefully we'll be able to talk about both, because I think there is the issue of vaccination, and then there's also the issue of testing right now as we're all trying to get together, because even if folks are vaccinated, as we were just talking about, it doesn't mean you're guaranteed to not be carrying COVID or to get really sick from COVID. So I'd love to touch on that as well. But in general, I think where I come from on this is trying to, as best you can, is to sort of prioritize your own comfort level. And I think that is so important, is know what what is going to work for you and for your immediate family and sort of the people you are who are sort of under your watch, right? So if it's your kids or, you know, the people who live in your home, whether it's older adults or whoever it is, prioritize what feels right to you and try to keep it personal. You know, try not to make it about the other people in the family or the other people in whatever relationship this is, but what this means to you and how it affects you. And we've had to talk to extended family members about the fact, as I mentioned before, you know, before our kids were vaccinated, to say, if our kids had to miss school for 10 days, this is a real issue for us. Or to be able to say, you know, I'm diabetic, and to say, like, I'm still considered really high risk. I'm fully vaccinated. I've had my booster shot, but you know, this is important to me. It is something that makes me exceedingly anxious when I think about getting together, and I want to be with you and I want to be able to do these things. And here's my comfort level, and really trying as best as possible to keep it about your priorities and your feelings and not necessarily about what they aren't doing or the choices that they may or may not be making.
Yes, I agree. And I am not a communications expert in any way, but I did, you know, last year at Christmas time, I had a 6-month-old, and, you know, people were not really vaccinated. Healthcare workers were just starting to get vaccinated. And I had to talk to my extended family and say, I'm not comfortable, you know, getting everyone together around my unvaccinated child. And, you know, my husband is high risk too. And so I've had these conversations myself. I think what was just mentioned is exactly what I would have said, is that people sometimes can kind of take it personally, and it's not that you don't want to see them, right? It's that you have to do what you feel is safest for your family. But I think it's also an opportunity to be creative in the ways that you can connect with people over the holidays. So I have a group of friends, you know, back from elementary school, and we get together every year and kind of exchange gifts. And what we ended up doing last year was we were outside around a fire. We had our chairs 6 feet apart. It sounds ridiculous, but it was a way for us all to still get together and enjoy the holidays together and celebrate together, where everybody felt comfortable. And so I think it's not always all or nothing. There may be ways to compromise where you really can make something happen that everybody does feel safe.
So I'm going to push the envelope on this just a little bit, just because it's real life, right? So, you know, in Black and Brown communities, there's a serious fatigue with pandemic. I've heard this running jokes that each variant, that we have so many different names for it now. They've turned the variants names into rock stars, into R&B musicians and different things. And when people are talking in that way, then they're just pretty, tired. In Black and Brown communities, people who are, they are fatigued of their life sometimes, in the way they have to maneuver through the world. And so I can see that we let our guard down and we just relax a little bit when we can, because it's family and we just don't know what is true or not true. So you have any strategies, you have any tips on people who are just very fatigued and want to be together, but don't want to argue about it?
Yeah, I mean, I think the first thing I would say is that feels incredibly real. and that fatigue is, I mean, the word I've been using recently is relentless. Like, this has just felt relentless. And I think if people are willing, I think the simplest thing to do is to do rapid testing and just have that sort of immediate sense of relief that, like, we want to be together. Let's everybody do a 15-second test. And just have that extra layer of comfort. I know from personal experience that there's a lot of people who are like, I got my vaccine, I'm not testing. I did what I was supposed to do. This is an over-the-top ridiculous request. And so I get that that's not going to fly in every family. But as sort of my first layer response would be, if people are willing to test, just test. You know, it gives everybody the peace of mind that you can safely be together.
I would agree. I think you mentioned this idea of fatigue, and I I finished a week of rounding over Thanksgiving, right? And I see healthcare workers are fatigued. My residents, our nurses, our staff, everyone is exhausted, right? So I 100% identify with that. I think you have to lead with a little bit of empathy, right? I think you have to acknowledge the fatigue, right? Acknowledge what people are going through. And that includes your own family. And I can say personally, right? I can be a little hard on my family because I'm the doctor in the family saying like, no, we have to be careful, right? And so you get a little rigorous, you get pretty clear about what needs to happen. And every once in a while, we have to remind ourselves that we're not intended to be inside away from people for almost 2 years, right? And sometimes you have to have the empathy to remind yourself and your family members that this is hard, that we understand this, and that why we're doing this, that we want to keep each other safe. And then you go to what Lauren mentioned, you talk about the things that are going to keep you safe, and you determine everyone's level of comfort, right? I feel uncomfortable if there's one person that feels uncomfortable with gathering, right? Everyone should be comfortable with whatever plan is laid out to gather. And everyone kind of has to have that empathy.
Thank you, Dr. Edwards Johnson and Lauren. I think that if we lead with empathy, then I think that the decisions that we make will be easier. If we lead with love, so I think that is so true what you just said, Dr. Edwards Johnson. And so I have a few more questions here from social media, of course, because that's where our whole lives take place, right? In social media. When will the vaccine be available for children 0 to 5? And what are some issues that we should be concerned about with this age?
So the latest that I have heard, but certainly if anyone's heard something more recent, please, correct me, is that Pfizer was still expecting to potentially have that data. They had said by the end of the year. I haven't heard anything more about that, and we're kind of getting, not that far from the end of the year. But my hope is that it will be very soon, because I have a child in that age group. I am counting down the days until he can get vaccinated. As far as, kids do very well with vaccines in general. Kids in this age group, they tend to be very resilient. There's nothing that I can think offhand that would make me more concerned about this age group getting a vaccine compared to a 5, 6, 7, 8-year-old. But I think we'll see what the data shows from the clinical trials and really be able to assess that and whether there are any different concerns in this particular age group.
Okay, thank you. And then just want to make sure that we're addressing all the questions that are coming through. So I have one for you, Ms. Rinaldi. Oh, we got another one from this area. Are we seeing it? Oh, yeah. So 2 of them now. How do you communicate to little ones? I see that you're a children's book author. How do you communicate to little ones about this whole process, the pandemic, and also about the vaccine and whether or not you should get the vaccine or things that they may hear? And then is there an increased anxiety in school-age children regarding COVID outbreaks? And anyone can answer that question.
Yeah. So I think, I'll speak personally. With my kids, it was really, the early days of the pandemic felt, first of all, it feels like a million years ago, but having to try to understand that and sort of where we suddenly so suddenly, like our lives stopped and we were out of school and we couldn't see anyone and we were washing our groceries and like, you know, putting the mail on the back porch and all of that. That I think was very concerning for, at least for my kids. That felt like a huge rapid shift of what is going on. You know, sadly, I think now it's normalized for them a bit in terms of like being in school with a mask, being masked, you know, with a play date, not necessarily being able to go indoors to spaces. You know, there are things they miss and it frustrates them. Like it frustrates me. I want to do these things too. But so being able to really just talk about, as we talk about, you know, other things in terms of like, you know, being a good community member and being a good citizen. And these are the things that we're doing to keep everyone around us healthy. We're doing this to keep grandma and grandpa healthy and you and mom and all these people. And these are the things we have to do. And sometimes it's not as much fun. And so we do try to find other things that can be a little bit fun. But I would also say that in terms of the anxiety, and I would, you know, love to hear other people talk about this as well. I think for my kids, the anxiety was not as much about getting COVID. You know, my son has been a close contact exposure, so he was exposed and had to be home. He never really felt worried about getting sick. I honestly think the anxiety really came when they just went back into school and they didn't remember what that was like. You know, my daughter left school in the middle of kindergarten and didn't go back until second grade. And she had very little memory of what school was like. And so I think just being thrown back into that environment, we didn't do a lot of transitioning into what it was going to be like to be back in school, to be away from mom and dad all day again. And so for me personally, that was where I really saw the anxiety. It was less about people getting sick, except for when we knew people who were getting sick or we knew people who passed away. That's obviously a very hard conversation. And if you have kids seeing a lot of that, that's a whole other level of anxiety and stress and trauma. But for my family, it was mostly about the sudden shifts in life changes. That was really stressful for them.
I appreciate Lauren sharing because I'm thinking, okay, I'm taking notes, like big shifts, like this is what I need to do. It was pretty similar. I have a 6-year-old who probably has the most context for the pandemic. And I'll tell you, there have been several points of pride because she has taken so much of this in stride and is very diligent from day one about wearing her mask. And we have been really transparent with what all of this means for her, right? And she has an understanding of needing to mask to protect other people and to protect herself. She has an understanding of, you know, her quote is like, when the pandemic is over, can we do this, right? And it is both amazing and heartbreaking because it's been 2 years that she's been saying, when the pandemic is over, can we do this, right? I think we have to both recognize that children are incredibly resilient, but they also need us to, as Lauren alluded to, give them that transparency, help them navigate those big shifts and changes, right? So that when they're going back into school, we're doing a little bit of that preparatory work. We're telling them that this might be something that's difficult for them to navigate and giving them the tools to expect that change and work through it.
I have to say that from day one you know, this is about the anxiety, just a follow-up, but from day one, when we were sent home in March, I think it was March 13th, I called for a family therapist and I enrolled everyone into therapy. We all have our own counselor, and then we all have the group sessions, because I just knew that we could not live in the house together for an entire 6 people, a 20-year-old and 3 teenagers and a dog and my husband. Oh my gosh, it would have not been good. And so I enrolled everyone into family therapy, and we did therapy via Zoom. And that was probably the best decision that I made ever in life, to have therapy. And sometimes if they didn't want to talk to, you know, they could defer that session to the next time. Best thing ever. We're still going. So I offer that as a suggestion. So what are the next steps to get the vaccine? And say hopefully this webinar, we have convinced people who are on the fence and convinced people who just said no from beginning to get their child vaccinated. So what are the next steps? How do they go about doing that? Where should they go to get their child vaccinated?
Well, one resource is always checking with your pediatrician. Those, I know not everybody who's listening is a University of Michigan patient, but for those who are, we have a very nice system through our portal to schedule an appointment. I assume other kind of, healthcare settings have similar setups to really try to hopefully expedite and make the process as easy as possible. But even some pharmacies are offering, I think not every pharmacy is offering to children under 12, but some certainly are. I think there's websites of kind of where to look to. So, but anyone who's actually had their children under 12 vaccinated may have better tips.
The Genesee County Health Department has multiple pop-up clinics for kids that are worth considering. It's the Genesee County Health Department has been a gem during the pandemic. Our students have been a part of the vaccine rollout with them. So I can't, they're a really great resource for go to look for an opportunity to get vaccinated.
I just have to say, I don't know if the Michigan medicine nurses went through extra training around how to comfort kids during this vaccine process, but I have a very vaccine hesitant child, and I have never had as smooth of a process as when he went and got his 2 shots. The entire staff were so comforting to my kids and to everyone in that room. It was really impressive.
So thank you everyone for such a great, robust conversation today. I would like to just offer you the last few minutes if you had any closing remarks, anything you'd like to say.
Yeah, so I'll start. And, it was mentioned, we're all tired of this pandemic, right? It has dragged on for much longer than I think any of us probably thought back in March 2020. And without a doubt, I know everybody on the panel, everybody who's listening, have had very important things happen in their lives over the last almost 2 years that have been, negatively impacted by the pandemic. Probably lots of them. We're all going through this. Hopefully this discussion tonight has been helpful with some tips to have a great holiday season in a safer way, first and foremost with vaccines. But I hope that everybody out there has a great, safe holiday season, however you celebrate. And I know we are all hoping for a wonderful 2022.
I'd like to thank you for having me, and I appreciate this opportunity to talk to people about why kids should get vaccinated. I also want to remind people that masking is incredibly important, right? Masking is one of our first lines of prevention in addition to vaccinating. I wish everyone a safe and happy holiday season, and thank you.
Yeah, I'll just add my thanks and gratitude for being here tonight. This was a really interesting conversation, just even for me to listen in on. So I really appreciate the opportunity. And I'll just, say to all the parents and caregivers out there, like, this is so hard. You're doing great. Like, you're doing your best. Just be kind to yourselves and to your, partners and family members, because, we really do need each other during this. And so just give yourself a little bit of leeway and a little bit of grace during all of this. And I wish everyone a happy new year and healthy new year.
Ditto. Yeah, thank you, everybody. And it's great to hear all this. And I do think there's a lot to be positive about. We have a vaccine, we have treatments, we're doing a lot better than we were doing before. So even though we're still feel like we're neck deep in this, there are ways to get around it. Fauci will say this, Dr. Tony Fauci will say this all the time, that without the vaccines, we would be in a lot more dire straits. And our science has worked and it's helped, and it's developed vaccines. Science has developed medications that are still coming out. So happy holidays. Try and enjoy them, everybody, and be safe.